Imagine waking up one morning, feeling a tightness in your chest and that familiar, nagging cough that just won't go away. For many of us over 70, a simple cold can quickly turn into something more serious, like bronchitis or pneumonia. This is especially true if you're managing other health conditions or juggling multiple medications. It can feel overwhelming and even a bit scary when your doctor says you might need antibiotics. After all, we've heard plenty of cautionary tales about side effects and medication interactions, but there's good news. There are certain antibiotics, often considered lower risk, that doctors might prescribe to address respiratory infections while minimizing potential complications. The goal here is to help you feel more confident, better informed, and safer when speaking to your healthcare provider about your treatment options. Many older adults face a real challenge, balancing the urgent need to treat infections with the genuine fear of adverse side effects. It's not just about clearing up that cough, it's about preserving independence, mobility, and overall quality of life. When an infection goes untreated or undertreated, it can escalate and interfere with daily tasks. Something as simple as getting up to answer the door or taking a short walk might suddenly feel out of reach. That loss of independence can weigh heavily, leading to feelings of frustration, isolation, or anxiety. Addressing respiratory infections promptly and effectively can make the difference between a slow recovery at home or a more difficult hospital stay. We're about to explore 5 categories of antibiotics commonly viewed as relatively gentle on older bodies, when prescribed correctly and monitored by a qualified healthcare provider. By learning about these options, you can begin to ask more informed questions at your next doctor's visit. You'll discover misconceptions many seniors hold about antibiotics and find out how small shifts in understanding can lead to big improvements in both recovery and peace of mind. The transformation promise here is simple. Gaining insights into these medications can help you advocate for yourself or a loved one, potentially leading to safer recovery from respiratory infections and a renewed sense of control over your health decisions. I'm someone who has spent years speaking with seniors, caregivers, and health professionals about best practices for aging well. While I'm not a doctor, I've gathered this information from reputable clinical guidelines and discussions with medical experts who specialize in geriatric care. Nothing you hear today is meant to replace professional medical guidance. It's meant to arm you with knowledge so you can have deeper, more productive conversations with the healthcare team you trust. As you listen, I invite you to reflect on your own experiences with respiratory infections. Perhaps you felt anxious about antibiotics in the past, or maybe you've been prescribed them frequently without fully understanding how they work or how to monitor side effects. If that resonates with you, consider jotting down any questions that pop up, things you want to discuss with your pharmacist or doctor. By the end of this conversation, you'll have a clearer picture of 5 lower-risk antibiotic options and the practical steps you can take to safeguard your health. Let's begin with our first category. It may challenge some of your assumptions about what low risk really means when it comes to antibiotics, especially for those of us who are living vibrant lives in our 70s and beyond. The first thing many seniors assume about antibiotics is that all of them are equally dangerous or equally safe. We often talk to friends who've had a rough experience with one medication. Maybe they ended up with an upset stomach or an allergic reaction, and we carry that story in our minds as a universal truth. But not all antibiotics are created equal, and older adults don't always tolerate them in the same way younger folks do. Take Robert, for example. He's 78 and has been active for most of his life. He loves to golf and goes for daily walks with his wife. But when he came down with a persistent cough that evolved into a wheezy, mucus-filled infection, he was quick to assume that any antibiotic would come with severe side effects like drowsiness or nausea. Robert's assumption was rooted in past experience. Years ago, he had taken a strong antibiotic that led to stomach issues. He swore off antibiotics after that, deciding that they were simply too risky for someone in his age group. But what he didn't realize is that healthcare providers have access to a wider spectrum of antibiotic choices than ever before, each with its own risk profile. Some options are milder on the gastrointestinal system, and some are designed specifically for respiratory infections that are common in older adults. According to many geriatric care practitioners, penicillin-based antibiotics are often considered first-line treatments for respiratory infections, assuming there's no penicillin allergy. These include medications derived from amoxicillin, which has been around for decades. While no antibiotic is free from side effects, penicillin-based treatments are generally well studied. They target common bacteria responsible for bronchitis, pneumonia, and sinus infections. The key is tailoring the antibiotic to the specific infection, your medical history, and any current medications you're taking. This is precisely why open communication with your healthcare provider matters so much. If your doctor suggests a penicillin-based antibiotic, consider asking about the rationale behind that choice. Are there known interactions with your existing medications, such as blood thinners or diabetes treatments? Does your doctor recommend taking a probiotic or certain foods to reduce gastrointestinal discomfort? Simple steps, like taking your antibiotic with a small meal, can help cushion the stomach. On top of that, staying hydrated is essential. Water aids in digestion and helps flush out toxins. Physically, using an appropriate antibiotic can help you clear the infection sooner, meaning less coughing and breathlessness. Emotionally, knowing that you're using a medication that has a long track record of safety may relieve some of the fear and anxiety that often comes with new prescriptions. It's empowering to realize that, even if you're over 70, you can still bounce back from a respiratory infection without feeling like you're rolling the dice on a risky medication. Before we move on to our next category, let's remember Robert's story. He challenged the assumption that all antibiotics are too dangerous, especially for older adults, and discovered that penicillin-based treatments can be an effective and low-risk place to start, provided there's no allergy or major interaction risk. Realizing that doctors can tailor antibiotic choices to each individual's unique medical situation is a key step in feeling more in control of your health. Now let's take a breath and reflect. Have you ever avoided seeking treatment because you worried about the side effects of antibiotics? If so, consider talking with your pharmacist or doctor about the broader range of options available. You might be surprised at how far medication research has come and how many paths to recovery exist these days. Our second category involves antibiotics known as macrolides. The biggest misconception about macrolides is that they're always harsh on the stomach, or that they inevitably cause disruptive side effects like severe diarrhea or extreme drowsiness. The truth is, while some older macrolides had a reputation for gastrointestinal side effects, newer formulations are crafted to be more tolerable, especially in seniors who might already be dealing with digestive challenges or reduced mobility. Think about Linda, who is 81 and has been living with chronic obstructive pulmonary disease, COPD, for several years. She's on a few daily medications to help with her lung function and maintain her quality of life. One winter, she developed a nagging cough that quickly escalated, making her usual afternoon walks impossible. Her doctor recommended a macrolide antibiotic to target the bacteria typically associated with respiratory flare-ups in COPD patients. Linda hesitated, recalling a friend who had experienced significant nausea from an older macrolide prescription. She worried she'd be stuck in bed with stomach cramps, losing her cherished independence and daily routines. However, Linda learned that newer macrolides are often formulated to minimize these side effects and have shorter courses of treatment. This is particularly valuable for seniors who don't want to take a pill for 2 weeks straight. By day 3 on her new antibiotic, Linda noticed improvement in her breathing and energy levels. While she experienced mild stomach upset on the second day, her doctor had advised her to split her doses or take them with specific snacks, which helped manage those symptoms. For seniors, the emotional benefit of a shorter course and a relatively gentle side effect profile can't be understated. It means less time feeling anxious about how the medication might affect daily life and a quicker return to normal activities. From a practical standpoint, macrolides work well against various strains of bacteria that cause common respiratory infections, including atypical pneumonia, which often strikes older adults more severely. If your healthcare provider recommends a macrolide, ask about best practices for taking it. Is it better absorbed on an empty stomach or with food? What sorts of side effects should you watch out for, and which ones might warrant a quick call to your doctor? Being proactive can help you feel prepared rather than caught off guard. Keep a simple journal for the first few days of treatment, noting any changes in how you feel. This daily check-in helps you spot patterns early, perhaps a mild headache at the same time each day, or slight changes in your digestion. If anything feels off, you'll have specific details to share with your medical team. One more thing to be aware of is that macrolides can interact with certain heart medications, potentially causing issues like an irregular heartbeat. This highlights again why a thorough medication review with your doctor or pharmacist is crucial before starting any new prescription. A quick conversation about your existing heart meds, blood pressure meds, or even supplements can help your provider catch potential problems in advance. Remember, there's a major difference between acknowledging possible side effects and assuming the worst. Seniors often benefit from macrolides when they're prescribed correctly, which can lead to a faster return to the daily routines we all value, like visiting grandchildren or simply enjoying a good book without coughing fits. Now that we've seen how two different antibiotic categories can serve as relatively low-risk options, let's pause for a moment. Think about any times in your life when a short, mild medication regimen made a world of difference in getting over an infection or recovering from a minor health setback. If you have a success story or a cautionary tale you'd like to share, consider discussing it with a trusted friend or family member. Having these conversations can help us all become more informed about the variety of treatments available. Moving on to our third category, we're going to explore cephalosporins, another group that challenges the assumption all antibiotics are basically the same. Many older adults don't realize that antibiotics are separated into multiple generations, each designed to tackle different types of bacteria and address different levels of severity. Cephalosporins are a prime example of how far antibiotic development has come, featuring multiple generations that vary in how they're administered and what bacteria they target. Take George, age 76, who recently found himself dealing with a nasty bout of pneumonia. It wasn't his first rodeo with lung infections, and in the past he had always received the same antibiotic. This time, though, his doctor recommended a newer generation cephalosporin. George was skeptical. "Why not just give me the same pill I took last time?" he asked. He assumed that the consistency of a previous antibiotic would be the safest route. However, his pneumonia had become resistant to that old standby, rendering it less effective. By transitioning to a more advanced cephalosporin, George was able to combat the infection effectively. Cephalosporins are often seen as a good option when penicillin-based antibiotics aren't advisable or when bacteria have developed resistance to older drugs. Many cephalosporins also tend to have a milder side effect profile when compared to some broad-spectrum antibiotics, which is critical for seniors who may already be dealing with age-related digestive changes. Of course, this doesn't mean they're without risks. Allergies, while rare, can happen, and so can interactions with other medications. Physically, using the correct generation of cephalosporin can mean more targeted treatment of your infection, hopefully leading to shorter recovery times. Emotionally, the reassurance that modern medicine has evolved to handle bacteria that are resistant to older antibiotics can be a significant relief. You don't have to rely on the exact same medication you received 2 decades ago. Instead, you can lean on the advancements that have refined how we address bacterial infections in older bodies. If your doctor brings up cephalosporins, ask questions. Which generation is being prescribed? Are there specific instructions for how to take it? Should it be on a schedule, like every 8 hours, or is it once a day? Will it be in pill form, or do they recommend an injection? Some advanced cephalosporins might be administered via IV in more serious cases, especially if someone is hospitalized. You'll want to know how the treatment plan fits into your lifestyle and your current medication schedule. When you're on any antibiotic, cephalosporin or otherwise, it's crucial to complete the full course. Stopping early can allow the infection to bounce back or give bacteria a chance to develop resistance. This is a common issue for seniors who start feeling better and decide they no longer need their medications. The short-term relief is overshadowed by the risk of recurrence or complications, which can be even more dangerous as we age. At this point, you might be noticing a pattern. Whether it's penicillin-based treatments, macrolides, or cephalosporins, what truly matters is the specific match between the antibiotic, the type of infection, your overall health condition, and your current medication regimen. This conversation with your doctor or pharmacist becomes much more meaningful when you have a basic understanding of the antibiotics family, potential side effects, and any relevant food or medication interactions. If you've made it this far, you're probably taking your respiratory health seriously, and that's a great thing. Do you have a friend or family member who might also benefit from learning about these distinctions between antibiotics? Consider passing along what you've learned or inviting them to join you in a discussion. The more we share experiences and knowledge, the more empowered we become. Next, let's talk about a group of antibiotics that often surprises people in terms of their versatility and potential for being relatively gentle on older adults when used correctly. These are the tetracyclines. Many seniors assume that tetracyclines, often known for treating acne in teenagers, have no role in respiratory infections later in life. That misconception can keep older adults from recognizing what might actually be an effective, sometimes milder option in certain scenarios. Mary, who is 73, discovered this by chance. She struggled with repeated bouts of bronchitis, each one a little worse than the last, leaving her fatigued and, at times, depressed because she felt she couldn't keep up with her gardening club or volunteer work. She assumed she'd be put on the same antibiotics she always used for bronchitis, but her new doctor suggested a tetracycline-based prescription. Mary was hesitant. "Aren't those for pimples?" she half-joked. But she learned that tetracyclines, such as doxycycline, can be particularly effective against some strains of bacteria that cause bronchitis and other respiratory issues. They've been around for a long time, which means doctors have a solid understanding of their potential side effects, like sensitivity to sunlight and the possibility of gastrointestinal discomfort, and they know how to mitigate them. For example, wearing sunscreen and protective clothing can lessen the risk of sunburn if the antibiotic increases your photosensitivity. Taking the medication with food can help reduce stomach upset. Emotionally, Mary was relieved that she didn't have to face the side effects she associated with stronger, broad-spectrum antibiotics, like significant fatigue or dizziness. Physically, the tetracycline cleared up her infection, allowing her to get back to her garden and community activities sooner than she expected. There's a deeper takeaway here. Sometimes an older class of antibiotics with a proven track record can be a safer, more effective choice than automatically jumping to newer, more potent drugs, especially when dealing with mild to moderate infections. If you're curious about tetracyclines, it's important to note a few key points to discuss with your doctor. First, tetracyclines can interact with calcium in foods, so you might need to schedule doses around mealtimes or dairy consumption. They can also interact with vitamins or supplements, particularly those containing iron or calcium, potentially reducing the antibiotic's effectiveness. Your doctor or pharmacist can give you a clear schedule, perhaps advising you to take your pills 1 hour before or 2 hours after a meal that includes dairy. Consistency is key. If you're inconsistent in how you take it, your infection might linger, or the medication might not work as intended. Adhering to the schedule also helps reduce the risk of contributing to antibiotic resistance, which is a growing concern worldwide, but especially impactful for seniors, who often have fewer resources to bounce back if an infection becomes resistant. For many of us, there's an emotional comfort in knowing that if something is time-tested and well understood, it may be easier to predict how our bodies will react. That's not a guarantee, everyone is different, but it's a factor worth considering when weighing your options. Rather than fearing you'll be knocked off your feet by a medication's side effects, you might actually find yourself benefiting from a well-studied antibiotic that your doctor recommends specifically for your situation. Before we explore our final category, think about the last time you encountered an unexpected solution to a long-standing problem. It might have felt surprising at first, but once you looked deeper, it made sense and turned out to be the key to resolving the issue. Tetracyclines can be that key for certain respiratory infections. Just remember to talk to your doctor about your complete medication and supplement list to ensure everything works together smoothly. Now let's turn to our fifth and last category. While we've covered penicillin-based treatments, macrolides, cephalosporins, and tetracyclines, there's a specific subset of antibiotics designed to minimize systemic impact on your body, one that many seniors overlook. These are inhaled or nebulized antibiotics used in specific circumstances to treat respiratory infections directly at the source. The common assumption here is that antibiotics always come in pill or injectable form, and that they inevitably circulate throughout your entire system. But in some cases, particularly in chronic conditions like certain forms of bronchiectasis or frequent pneumonia, doctors might recommend inhaled antibiotics to deliver medication right to the lungs without flooding the rest of the body. This approach can reduce the intensity of side effects that sometimes accompany oral antibiotics, such as upset stomach or more severe gastrointestinal issues. Consider Carlos, who at 77 has struggled with recurring pneumonia for years. He's often been prescribed oral antibiotics, and while they helped clear the infection, they also wreaked havoc on his digestive system. He was losing weight because he felt too nauseous to eat and dreaded starting another antibiotic course. Then a pulmonary specialist suggested he try an inhaled antibiotic regimen. Although he was initially unsure, learning to use a nebulizer can be an adjustment. Carlos found that his stomach issues dramatically decreased. The medication targeted his lungs directly, helping to clear the infection without overwhelming his digestive tract. Of course, inhaled antibiotics aren't suitable for every type of respiratory infection. They're often used when the infection is localized and your doctor deems it a good match for your situation. The potential side effects may shift. Some people experience throat irritation, coughing, or an unpleasant taste. You also need to clean and maintain the nebulizer properly to avoid any new infections that could come from improper usage or device contamination. Emotionally, many seniors find relief in knowing that they can sidestep some of the more challenging side effects of oral medications. Physically, targeted antibiotic delivery can lead to a more direct impact on the infected area, potentially speeding up recovery or reducing the severity of ongoing lung issues. It can also be a valuable option if you're dealing with multiple chronic conditions that make oral medications more complicated. If your doctor suggests inhaled antibiotics, make sure to ask for a demonstration of the proper technique. It's vital to follow a clear routine. Washing your hands before handling the medication or nebulizer, running the machine for the recommended duration, and thoroughly cleaning all parts afterward. Keeping track of how you feel during each treatment session is equally important. If you notice increased coughing or wheezing, you can report this back to your healthcare team so they can adjust as needed. The significant emotional takeaway is that seniors have more choices than ever before when it comes to antibiotics for respiratory infections. You don't have to be boxed into a single approach. By working closely with your doctor, you might discover an option that not only treats your condition effectively, but also fits more comfortably into your daily life and medication schedule. Those are our 5 categories: penicillin-based antibiotics, macrolides, cephalosporins, tetracyclines, and inhaled or nebulized antibiotics. Each has its own strengths and potential drawbacks, but all can be considered relatively low risk for many seniors when properly prescribed and monitored. Now let's bring it all together and talk about how you can apply these insights in your everyday life. When you think about all the concerns seniors commonly have about antibiotics, the fear of harmful side effects, the worry about interactions with existing medications, the desire to maintain independence, it can feel overwhelming. Yet the 5 categories we've explored show that there truly are multiple pathways to safely address respiratory infections. By recognizing that different antibiotics work in different ways, you empower yourself to speak more openly and confidently with your healthcare team. Instead of simply accepting whatever prescription is handed to you, you can ask questions about which category might be most suitable, why a certain antibiotic is being recommended, and how you can minimize potential side effects. Time is of the essence when dealing with respiratory infections. Untreated or inadequately treated infections can escalate quickly in older adults, sometimes leading to hospital stays or long-lasting health setbacks. But urgency doesn't have to translate into panic. Armed with the right information, you can seek help promptly, discuss options confidently, and commit to a treatment plan that feels secure and manageable. Imagine the difference it could make in your daily life if you no longer dreaded antibiotic treatments. Maybe you'd be more willing to catch an infection early instead of waiting and hoping it goes away. Or perhaps you'd finally feel comfortable enough to travel for a family reunion, knowing that if you catch a cough or a cold, you have viable low-risk treatment options. Small changes in perception can lead to big shifts in how you approach your overall well-being. If you're ready to take a step further, here are a few suggestions. First, create a simple medication list, noting everything you take regularly, including supplements. Share it with your doctor at your next appointment. Second, if you're experiencing symptoms of a respiratory infection, don't wait. Seek professional evaluation right away and ask if one of the 5 antibiotic categories we discussed might be a fit for you. Third, consider sharing this knowledge with a friend or neighbor who might be dealing with similar concerns. The more we support each other, the more empowered our entire community becomes. For those who are just beginning to explore how antibiotics can help them tackle chronic or acute infections, your call to action might be as simple as booking a checkup with your healthcare provider. For those who are already well-versed and want to go deeper, you could explore local seminars or online resources that discuss medication management in more detail. And if you're somewhere in between, subscribing to newsletters from reputable health organizations or joining local senior forums can keep you updated on new developments in geriatric medicine. Above all, remember that you are not helpless when it comes to your health decisions. You've accumulated decades of wisdom and life experience, and that perspective matters. By approaching antibiotics with curiosity and clarity, rather than fear or complacency, you stand a better chance of maintaining the active, fulfilling life you cherish. Your health is your journey, and with the right information, you can continue traveling that path in a way that feels safe, supported, and empowered. Thank you for taking the time to listen, reflect, and explore the possibilities. May your future encounters with antibiotics be guided by knowledge, careful consideration, and a renewed sense of confidence that you have options designed with your well-being in mind.